Good afternoon. Today is April 17th, 2020. Thank you for joining us today for our webinar on workplace safety programs for manufacturing COVID-19. My name is Beth Gallick, and I am the Executive Director of the Bay Area Manufacturers Association, or BAMA. This webinar today is made possible thanks to the Florida Makes Network. Florida Makes is the manufacturing extension partner for the state of Florida. We have some exciting news. Florida Makes, in partnership with the Associated Industries of Florida and Space Florida, announced last week the deployment of an online database for Florida's small to large manufacturers to engage in the marketplace. The online database connects Florida, started as a disaster risk mitigation effort in the aftermath of Hurricane Irma, and it's proving to be a critical tool to streamline connections between Florida manufacturers and businesses in need of their products during the COVID-19 pandemic. To request access to this platform, visit florida.mfgconnex.com for more information, or you can go to the Florida Makes website at floridamakes.com. You can also share your capabilities through an online survey. This survey link will be provided to you in the follow-up email after the webinar. BAMA, your host for today's webinar, is proud to be part of the Florida Makes Network. We support manufacturers and promote economic development in the Tampa Bay region. BAMA provides a forum to exchange ideas and share best practice information, network with colleagues, and learn about manufacturing-related topics through educational programs and tours. BAMA supports STEM programs and offers scholarships to students pursuing manufacturing and STEM education. If you would like to know more about us, please check out our website at www.bama-fl.org. And if you're an attendee from a county that BAMA doesn't service, please contact Florida Makes and they can connect you to your local regional manufacturers association. As a participant, your audio will be in listen-only mode using your phone or computer. There is an opportunity to ask your questions using the question window. Just add your question there and we'll address those as time allows at the end of each presentation. This is a live webinar event which will be recorded, and a link to the recording will be provided to you within a few days, in addition to some of the attachments we've talked about today. Today's presentation is titled COVID-19 Best Practices, General Manufacturing Coronavirus Workplace Safety Program. I would like to introduce now Hildy Haviland from BKS Partners. Hildy is a commercial risk advisor, BAMA member, and co-chair for the 29th annual Kelly Murphy Memorial Golf Fundraiser. This yearly event raises funds for our manufacturing scholarships and STEM sponsorships. So I'd like to turn it over to Hildy now.
Thank you, Beth and BAMA, for having us today. We hope everyone is staying healthy and safe at this time. I'm honored to introduce our expert speaker today and my colleague, Patrick Kirby. Patrick is a Senior Director of Client Experience and joined Baldwin Christian Sherman Partners in 2012 after spending more than 20 years working in the automotive, retail, pharmaceutical, and transportation industries. Patrick specializes in providing profit-enhancing strategies and solutions to organizations by working with senior leaders, mid-level managers, and customer-facing professionals to identify root causes of profit and revenue drains and develop solutions tailored to the organization and its culture. So without further ado, the floor is yours, Patrick.
Well, thank you very much, Hildy, and for introducing me, and Beth for having me on today. And good morning, everyone. Again, my name is Patrick Kirby, and I work at Baldwin Christian Sherman Partners, and I'm happy to have you here. And again, welcome to your 32nd, 33rd, or 34th webinar on COVID-19. But in all seriousness, I have, I think, some really good information to share with you today. And this isn't going to be one of those presentations where I go through and give you a whole bunch of information that you just take back and you're kind of on your own. We're actually going to provide you with some general templates and information that's going to help you develop and or enhance your current infectious disease pandemic program. And I'll get to that in a minute, and I'll also show you how to access it. And I know it's going to be accessed, I believe, through BAMA and this presentation, as well as through several website links that I will provide. But what are we going to talk about today? So in hindsight, you know, I'm going to talk to you a little bit about why I have an infectious disease program or pandemic program. I think all of us would agree that if I came to you 3 months ago and said, hey, you really need to have a pandemic program or IDP at your facility, you might look at me, either say that I'm crazy or say, you know, the economy is great. I got a bunch of other projects to do that's not real high on my priority list. But of course, now it's very high on most people's priority list. And in fact, I'm seeing many businesses start and insurance carriers requiring that you have one of these programs in place. So we'll start with that and then talk a little bit about who needs one. I'm going to walk through how to develop an effective program as well, and then talk to you about what if someone tests positive. I'm going to get into a little more detail there because I've dealt with several situations inside facilities and helped coach and guide them through when somebody does actually test positive for COVID-19. Some program essentials that you need to have in your program. And then I'm going to share some manufacturing best practices that I've gathered up either through research, conversations with my current manufacturing clients, and from other sources as well. So with that, why don't we just start and let's see. So why have an IDP program? Employers, as you well know, have a duty to provide a safe workplace. Our friends at OSHA are the ones that require us to do that. Another reason is to keep us in business in times like this. I personally believe that in crisis, whether it be hurricane, pandemics, et cetera, that having a plan in place allows us to have a competitive edge against our competitors in the marketplace because we're better equipped to deal with it and then deliver our products or services to our customers or clients. And it also keeps our workers employed so they can provide for their families. Now, these three are kind of directed at facilities that are still open or, you know, maybe operating at full capacity. There are a number of them. But what if you're in a facility that doesn't have a, you know, has reduced or has closed due to the pandemic? An IDP is going to allow you to identify what needs to be in place to safely return and operate. If any of you were listening to the news or something over the last day or so, they're kind of phasing in an approach to reopening the economy. And I think all of us are questioning, well, when we bring all of our workers or employees back, you know, how do we make sure that our workplace is safe over the next few months and make people feel comfortable coming back into the workplace? All right. So who needs a program? Well, the pretty obvious one is every business that operates needs one of these programs. And in addition to that, especially those that provide critical services such as manufacturing, hospitals, agricultural, mining, transportation, all of those that provide critical services to the community. And I did make a note there, of course, those ones that are producing toilet paper and healthcare items and so forth, those are critical things that we all need to have. And who knows in the next pandemic what we might be running short of. So other entities, governmental entities, and wholesale and retail distributors as well need to have a program in place. All right, so how do we develop an IDP program? I've built out about 7 steps. A lot of many of the steps that I have created come directly from OSHA. But the first step that we do is to educate ourselves and our organization on the pandemic at hand, and utilize resources from reputable areas. Things like the CDC and OSHA are two excellent areas where you need to draw most of your information from. I've provided the website links to each of these, and on the right of your screen, you'll notice that OSHA has produced guidance on preparing workplaces for COVID-19. This is about a 30-page document that walks you through all of the different aspects of workplace safety that you need to take into consideration when developing your program. And the good news is, as I mentioned before, we're not just going to give you a whole bunch of information that you are going to take notes and then have to recreate an entire program yourself. Instead, we have built a manufacturing template that has most of this information in it, but it is built for a general manufacturer and may not take into account everything that goes on inside your facility. And I'm going to walk through the different steps that you need to take that template through to make sure that you customize your individual program to your facility or to your organization. Another excellent place to get resources from, is the BKS Partners website. We have a COVID-19 response resource website that takes reputable information from CDC, OSHA, and other reputable sources and puts it all in one area for you. I've provided the URL for that for you to access. And this is where you can also access the workplace safety programs for manufacturing, the templates for general manufacturing that we have produced for you. And those are available in Word because you'll need to update those using the steps that I'm going to go over today. And I should also mention it's also available in Spanish as well. So part of educating yourself and your organization is training them on your overall program. And again, on the left-hand side is our sample, a picture of our sample program. And I've also included a URL to access that document directly from our website. And you also need to educate yourself and your organization on workplace hygiene. And there's training available inside that program for coronavirus and workplace hygiene, both in English and Spanish. So I'd highly encourage you to either visit the site or utilize the attachments to this webinar to get yourself started on developing and or enhancing your current program. So step 2 is to determine your risk level. So once you get the template to start with, where, how, and to what sources of COVID-19 or SARS might workers be exposed to? Things like considering, are they exposed to the general public, customers, or coworkers? What about sick individuals or healthcare workers, et cetera? Other things to take into consideration are like non-occupational risk factors that are or at home. You have employees that have a sick person at home that's tested positive for COVID-19. What about someone that works in the healthcare industry, et cetera? Or what's going on in your community? What's going on in New York is a lot different than what's going on in the Tampa Bay area. So when you determine your risk level, you need to take those items into consideration as well. Workers' individual risk factors. You may have a population that may have an older age or present a chronic medical condition or comorbidities and other conditions. You need to take those into effect when you write your program and develop your procedures and protocols. And then from that information that you gather, you need to put controls in place that are necessary to address those risks. Now, what OSHA has done for us is determined different risk levels or exposure levels that we have to COVID-19. And it's a highly scientific risk exposure level matrix that includes very high exposure, and on the next slide, it's medium and low exposure. So the importance of putting yourself in one of these buckets is in the guidance for workplace safety for COVID-19 from OSHA. They list out engineering, administrative, and personal protective equipment protocols for each level of exposure risk. Now, you don't determine this on your entire facility as a whole. Rather, you look at the individual activities that are going on inside your manufacturing facility, either a manufacturing line or a tool and die or the maintenance area, and you determine whether that's very high, or medium exposure. Now, very high and high exposure risks are probably fairly rare in manufacturing, although there might be some circumstances where you have it, but this is generally reserved for people working directly with the COVID-19 virus in like a lab or like healthcare, medical transport, morgue workers, etc. Based upon, my research and my experience inside the manufacturing arena, I believe that most manufacturing activities are going to take place in the medium exposure risk. And this would just essentially be jobs that include folks to work within 6 feet of one another. You may be working around a coworker that may have been infected with, SARS or COVID-19, or maybe have someone at home. It's just an unknown. You might have some frequent travelers that come in and out of your manufacturing facility. You likely don't have a lot of contact with the general public like a retailer does, but you may have a high population density to work environments. You might also have a little bit of low exposure risk out there. This would be, the office jobs that are inside your facility may not have a higher risk as, other areas of your facility. The importance of determining your risk level is determine the actions that you're going to take around engineering controls, administrative controls, PPE, and things of that nature that are defined in that guidance for COVID from OSHA. And again, that's available on our site and on the website itself, the BKS website. So step 3, now this is going to be a little bit more obvious. So once you've determined you've educated yourself, your organization, you've determined the risk levels, you want to implement the basic infection prevention measures that I think we've all heard about. Things like frequent hand washing and or use of 60% alcohol hand sanitizers, respiratory etiquette around covering your coughs and sneezes, your stay-at-home sick policies, etc. And the good news is most, if not all of these, are in the general template for workplace safety that we are providing for you today. Other things to take into consideration are eliminating visitors unless they're critical to your facility, limiting vendor access to the facility. You have people delivering raw materials or product that are used in your manufacturing process, etc. You may have let them inside before. You may want to develop some protocols around keeping them outside of your facility as not to contaminate it. And then consider flexible work sites and hours to increase social distance, things like telecommuting for your office staff, staggered shifts, potentially some zoning of your facility to increase that social distance. Discourage workers from sharing tools, equipment, and phones. I know a lot of facilities out there share equipment, share tools of various natures. If you can, I would highly discourage sharing tools, but if you can't, you really need to have a cleaning and disinfecting plan in place that deals with that unique hazard. And in addition to that, having a cleaning and disinfecting plan that periodically goes around and cleans high-touch areas such as break rooms, bathrooms, door handles, all of the printers, the common areas that everyone touches. And I just spoke to the shared items like tools, equipment, product, raw materials. When someone uses it and it's time for the next person to use it, you should have a protocol in place where those things are disinfected. And I believe in a previous webinar that BAMA put on, you had someone on that talked about how to disinfect. And you want to use disinfectants that are approved by the CDC/EPA, and we provided a URL for that where you can get a list, and on there you need to read the manufacturer's instructions on how to use it, what types of surfaces to use it on, and in particular, how long do you leave it on the surface to do an adequate job of disinfecting the workplace. So step 4 is to develop procedures for the identification and isolation of sick people. Again, this is folks that may be exhibiting signs of the flu. They haven't actually tested positive, but we want to encourage employees to inform you, of course, when they're sick, and then immediately isolate sick employees. We have had a couple of instances where there's been more than one person in a facility exhibiting signs of the flu. In that case, you don't want to commingle. You want to isolate them in particular areas, provide them immediately with face masks, inform other employees to vacate the premises, and potentially quarantine for 14 days. That's going to depend on a positive test, and then encourage sick employees to be tested. And then encourage workers to get clearance from their medical provider before returning to work. Now, if you remember earlier, I mentioned to educate yourself and your team. You also need to keep apprised during the pandemic of new items that are coming up in the news and recommendations from CDC. When I wrote this earlier this week, the recommendation from CDC and OSHA was to encourage workers on this last bullet point to get clearance from their medical provider before attempting to return to work. That's because there was concern that we might overwhelm our healthcare providers with requests for this type of thing. But last night, when I was listening to the news, Dr. Birx with the CDC was actually saying that employers, is one of the phases, need to mandate that someone returning to work needs to have clearance from their medical provider before attempting to return to work. So let's take a look at step 5. Now, this is around a little more detail on implementing workplace flexibilities and protections. This is about having flexible and consistent policies ahead of time around public health guidance and current laws, things like sick leave, including taking care of sick family members. If you do have employees that are taking care of family members, et cetera, at home, whether or not they're just sick and you don't know whether they have COVID-19 or they've tested positive, having the ability to provide them with some residential and home guidance, which I've also provided a URL for there. Require companies also that you do business with to provide their infectious disease plan to you as someone's delivering raw materials or product into your facility, their drivers are showing up at your location, et cetera. You want to make sure that they have the same precautions in place that you would expect out of your employees, so you don't have an unexpected introduction of an infectious disease into your facility from an outside source. Provide adequate, usable, and appropriate training and education. I think that's kind of a no-brainer. But include proper hygiene practices around PPE. That's highly important. And then work with your insurance companies, particularly your healthcare providers, and inform your workers about medical care on COVID-19 as well. In step 6, we want to assess and implement workplace controls. Now, I have tailored these to the medium risk. Most, as I said earlier, most manufacturing is going to fall under a medium risk. So when we implement the workplace controls, I wanted to kind of focus on medium risk items. If you determine that you're in the very high or maybe high risk, or an activity is in high risk, please refer to the OSHA guidance for workplaces on COVID-19 for a little more information on that. So the first step under medium risk is engineering controls. So what are engineering controls for those of you who may not be familiar with them? These are controls that really do not involve employee behavior. These would be physical barriers and other types of controls that reduce exposure or hazards without relying on something like worker behavior, et cetera. Some examples of this would be installing high-efficiency air filters in your facility, increasing ventilation rates in the work environment, installing physical barriers such as your plastic sneeze guards and so forth that you see like at Publix. I could see that happening inside a manufacturing environment, depending on how close you would have your workers working together, et cetera. There are also, the second one is administrative controls under a medium risk environment. And administrative controls require an actual action by the worker or the employer. Some examples of administrative controls would just be encouraging people to stay home when they're sick, or replacing face-to-face meetings with virtual meetings. In a manufacturing environment, adjusting shifts, breaks, restroom use, and work hours to increase social distancing. Training workers on PPE would be another, limiting or discontinuing travel. Those are all administrative controls that you need to consider as you're evaluating the risk exposure level inside your facility. And some other items around PPE or personal protective equipment. So if you've identified an activity as medium risk, these are kind of the things you would want to consider putting into place to protect workers from the spread of COVID-19. So gloves, goggles, face shields, face masks, respiratory protection, et cetera, would all be examples of PPE. And then making sure that you do a good hazard assessment on the effectiveness of that PPE, and making sure you're using sources like OSHA and the CDC when you employ those is also important. So in step 7, it's just follow your existing OSHA standards. I put this in as I don't think at this point we really know how OSHA is going to react to safety in the workplace around COVID-19. My experience is if we have bad outbreaks in certain facilities, or there's a problem in certain facilities that they may target certain industries, we certainly want to be prepared for that. And if we are recommending personal protective equipment, we need to follow OSHA standards around PPE, around gloves and eye and face protection. And we need to refer to the respiratory protection standard around fit testing of respiratory devices, providing training on how to properly use it to make sure that it's being deployed properly, et cetera. The bloodborne pathogen standard, although this does not usually include respiratory secretions that transmit COVID-19, I could see someone sick, contaminating an area, maybe getting sick in the restroom, et cetera, and being exposed to bodily fluids. Most of our facilities have bloodborne pathogen kits in them that have PPE and instructions on how to use it and clean it. So we want to pay attention to that and train our personnel on that. And then, of course, OSHA's general duty clause that requires us to furnish each worker with employment and a place of employment that's free of recognized hazards. So we want to make sure that we're following those. I'm going to get into a little bit more detail here, and this actually is included in the template for COVID-19, the manufacturing safety program that we've provided. But I want to go over this in some detail to make sure that we all kind of have a good understanding of what we need to do if someone actually tests positive for COVID-19. So if someone actually notifies us of it, we need to instruct, of course, that infected worker stay home for at least 14 days. We also need to assure that infected worker that he or she will not be identified by name to coworkers, as that could be an ADA or HIPAA violation. Now, having said that, we also have a duty to inform others inside the workplace that they may have been exposed to someone who had COVID-19 or another infectious disease. In those circumstances, we need to establish the relevant 28-day period. Now, that may sound new to you, but the 28-day period I'm going to get into in these following bullet points. It could be longer too, depending on the facts and the circumstances, but the first 14-day period has to do with from the date that the person or infected worker was actually tested is going to help you determine the 14 days forward and the 14 days backward, or the 28-day window that you need to be concerned with. The first 14-day window will help establish the scope of the mitigation efforts with regards to your other workers. The second 14-day window is going to help establish the quarantine period for the infected worker themselves. Of course, that's subject to the opinion of any qualified health professional that may give you contradictory information. But for example, if the worker tested positive on March 1st, the worker should at a minimum remain home from March 1st to March 15th. Furthermore, the employer or us on this call should identify where the infected worker worked, as well as those individuals the infected worker came into contact with between February 17th and March 1st, 2020. The reason that's important is because the February 7th to March 1st is going to help you identify those employees that may be infected as well. And then there's some protocols to go along with that. But in addition, ask the infected employee, to the best of their recollection, to identify all the areas in the office where they were physically present. That's so we can have those areas sanitized immediately, hopefully by a qualified professional or in accordance with CDC guidelines. I would highly recommend getting an outside company to come in and clean and disinfect your facility, or in the, we did have a manufacturer have a small area of their facility that they could isolate where someone who had tested positive for COVID-19 was, and they only had to clean that area. But in general, you want to have your facility cleaned by an outside qualified professional. Ask the infected employee also, to the best of their recollection, any individuals that they may have come into contact. Again, that's between February 17th and March 1st. And then you're going to want to contact those employees identified in that previous bullet. And without disclosing the infected employee's identity, advise them that an individual that has been physically present in the work area has tested positive for the virus. Request that those employees stay home for at least the next 14 days at a minimum, and encourage them to self-quarantine, and then encourage the impacted employees to reach out to a qualified healthcare provider to seek advice on what additional steps they should take, if any. Again, without disclosing the affected employee's identity, advise your employees that an individual has been physically present in the office during the prior 2 weeks and has tested positive. Advise your employees that the office or facility or identified areas where the employee was tested will be shut down so that the office or facility can be clean and sanitized. And then consider shutting down the facility completely for 14 days, depending on the severity of the outbreak. Now, I put in quotations here, depending on the severity of the outbreak. If you have a large, widespread outbreak, that would be highly recommended. However, in the ones that I've dealt with, it's been localized and isolated, and it's only really impacted the facility for maybe a day or two until they could get it completely cleaned and bring workers back into the facility. So program essentials, and again, all of this is included in your template that we have provided to you. So starting with company commitment and responsibilities, worker training, we've got travel protocols in there. We have your workplace and worksite protocols. Again, these are of a general nature. You're going to need to follow the steps that I just went over to customize this program to your individual facility. Have transportation protocols if you have vehicles that people drive in the facility. I just went over what to do when a worker tests positive. Those steps are in there as well. And please, and the one thing I probably haven't talked to enough throughout this presentation is around documentation. We need to document the training that we're giving to our employees. As most of you may know on the call, if OSHA comes in and asks for your training around your infectious disease program, and you cannot produce documentation, including the employees' names and their signatures, then they consider that training never happened. In addition to that, documentation can protect you from liability during an outbreak. An example of that may be if you are doing a good job and have a cleaning and disinfecting regimen inside your facility, where you are cleaning your high-touch surfaces, using your cleaning your hand tools and equipment that is being shared, and maybe you're even doing a deep clean once every week. Some of the manufacturers I've talked to are doing that. Those items need to be documented. So as you do it daily, document that you've done it. The reason for that is if you do have an outbreak, and in some of the situations I've dealt with, we have had those outbreaks, you could find yourself in a lawsuit afterwards that you didn't take the proper steps to ensure the spread of COVID-19 in your facility. So it's highly recommended that you document those processes. All right, so let me share some manufacturing best practices that I have gathered over the last month or so from talking to our current clients, other manufacturing clients, and doing some research. So I just spoke at length about this one right here: establish and document a facility cleaning regimen. In most circumstances, when I have talked to manufacturers, they are cleaning high-touch areas. I found that they're doing it daily at a minimum. That's doorknobs, tables, sinks, bathrooms, any other high-touch areas. They also have a procedure in place where they are cleaning tools, normally after each person's use. And then they're deep cleaning the entire facility, normally on a weekend, like a Sunday, potentially a day that you're closed, where they have a third-party company come in and clean the entire facility. But again, establish one and document it. Some other best practices: washing or sanitizing hands for 20 seconds prior to the work shift. So prior to even going to work, we want to have our employees do that. Before and after each break they take, and then prior to leaving for the day, are all best practices I've seen in the manufacturing arenas. Eliminate the use of common refrigerators, microwaves, ice makers, and water fountains. Although that makes it difficult, a little bit difficult for people to come into work with lunch, they need to come with a pre-prepared lunch so as to minimize the number of high-touch areas inside your facility. Consider providing water bottles rather than water coolers. I do know that many manufacturers have removed the water coolers and again are just providing a bottled water to their employees. And then consider taking the temperature of all workers with a non-contact thermometer prior to them showing up for the shift. And this is an attempt to isolate and identify workers who may be sick and coming into work because they have a dire need, to work for pay. And those were some of the personal hygiene best practices. As far as social distancing is concerned, some other best practices are limiting restroom use to a minimum number of workers. Now, this is going to depend on the size of the restroom and the number of restrooms that you have, but highly encourage no adjacent occupancy between toilets and sinks. Assign specific break and lunch times to minimize how many people are in the break rooms at any one time. And then where workers cannot be 6 feet apart, provide face masks, work gloves, or even engineering controls such as plexiglass screens and so forth. Limit facility access to essential personnel only, no visitors. Restricting worker access to their work areas only, we kind of call that zoning. Restrict access of vendors and contractors. We spoke about that a little bit earlier. Your essential meetings down to 3 people at a minimum. That's going to depend on your meeting area and how large it is. Again, we're trying to social distance 6 feet or more. Limit and/or prohibit non-essential discussions and gatherings. I guess that's the old water cooler talks that they're talking about there. And then just, I have some more brief other considerations. So if you have key personnel inside your manufacturing facilities that are critical to the operation of them, in other words, if this person got sick or this group of people got sick, you would not be able to function I would highly recommend that you separate them from each other into different areas if possible. That's to protect them from being part of an outbreak in a certain area and decrease the likelihood of all of them becoming infected. And be proactive. I spoke at the beginning of the presentation that communicating your pandemic program to your customers and clients, either now and in the future ahead of time, can really give you a competitive advantage in a situation like this. I know that myself and many of the manufacturers and contractors and so forth that I've talked to that have had an IDP program in place have noticed that those are the companies that people want to deal with. And when we get through this thing, when we're out of this thing in May, June, or July, whenever it happens, these our clients and potential customers and clients are going to remember what we did for them. Pre-order disinfectants and PPE and raw materials. Now remember, I did not say hoard here, but pre-order enough to have on hand to properly disinfect and properly stock your facility so you can actually produce the needed items that you need. And then identify and develop relationships with cleaning companies ahead of time. Places like ServPro would be a good place to start. Those are the third-party companies that will come in and deep clean your facility. And with that, I would like to open up the webinar to questions that you may have. I do have Anna Evans with me from Baldwin Christian Sherman to help with questions. Anna Evans is a licensed work comp adjuster in the state of Florida. She's a manager of claims advocacy for us. She also holds SHRM designations as well, and has great knowledge inside the human resources world. So with that, I would like to open up the webinar to questions.
All right, thank you very much. We do have a few questions. Can an employer force a sick employee to stay home even if they have not tested positive and have no sick time?
Thank you and
Anna,
good morning.
I believe that one's for you.
Yeah, good morning. This is Anna Evans. Good morning and thank you to everyone. Let me preface this by saying that according to the CDC, the coronavirus, as we know, not only is this serious, but it is legally considered a direct threat. And the reason why I say that is because per the CDC and the EEOC and the ADA, we now have guidelines under a direct threat. So an employer can request or force an employee to remain home if they are symptomatic. If they have symptoms as fever, chills, cough, shortness of breath, an employer can request that that employee remain home. Even if they no longer have sick time available through the company, they do have sick time, emergency sick time through the FFRCA, which is the first emergency family plan that the CDC enacted and our government, which is federal, enacted. If you do not have the posters, let me know and I'd be more than happy to send those to you, and I'll get to that in a second. But yes, an employer can request and ask the employee to stay home.
Thank you, Ann. And can an employer force an employee who tests positive for COVID-19 to inform them?
Yes, because we are under a direct threat, yes. And as Pat had mentioned beforehand, it will be kept confidential, but the employer has the obligation to find out who has that employee been in contact with, and also to protect the coworkers too. So absolutely, yes, an employer can require an employee who tests positive to inform his or her employer.
Okay. We also had a question if the slides will be made available. Yes, they will. Following the presentation, everyone that's registered for the webinar will receive an email that will include the entire, the link to the presentation, which is located on Florida Makes YouTube channel, as well as all the documents, slideshow, and links. So that will all be provided. What if an employee performed plant-wide work and cannot determine the exact location of all work?
They should try to narrow it down as close as possible. You know, the source is always going to be vague right now because we are in a community exposure.
Okay, thank you. Another question is,
I would also, Beth, I would also add to that. I think the individual was speaking, broadly about someone who may be a maintenance, someone in maintenance, maybe a forklift driver, something of that nature, who has access and needs access to the entire facility and maybe in just about every area. As part of your hazard assessment, when you're determining the risk exposure levels, whether they be high, medium, or low, I would say in that respect, depending on that person's exposure to other people and surfaces and so forth, that may fall into an arena maybe between medium and high, where you may want to provide that individual with additional PPE, maybe require them to wear a face mask, wear gloves, et cetera, and maybe define the planned regimen of hand washing and or use of a hand sanitizer more often than someone who doesn't come into contact with as many people.
okay, thank you, Pat. And that was in regard to sanitation that she was asking the question.
Okay.
All right, and what if an employee does not show up for work because they say they're scared? It's a no show, no call situation. Is that grounds for termination?
It could be, but we are in a trying and stressful time right now. The employer should make every effort to keep communication, but being scared to return back to work will not fall under the paid sick time. Unfortunately, the employee will not get paid. I mean, that's not a reason to remain home, especially if the employer, and we should distinguish if the employer is an essential employer or not.
Okay. What are the testing result requirements for the infective employee to return to work after testing positive for the virus? Does it take 2 negative results?
Not that I'm aware of, but that, even on the first, if they test positive, they have to quarantine for 14 days. They are changing the testing result requirement constantly. So I'm not aware of the 2 negative.
Thank you, Ann.
Yeah, Anna, I am not aware of the 2 test negative either. However, I am aware of what I mentioned earlier in the presentation, is that before a worker comes back who's tested positive for COVID-19, they need to have clearance from their medical provider, and that's probably the most important piece to have. You wouldn't want to introduce someone back into the workplace without that.
Okay. Absolutely. Yeah, absolutely. They need medical clearance. No question about that.
And when their temperature is taken, is that to be taken in front of everyone or just known by the manager?
It is not to be taken in front of everyone.
Yeah, what would be the
It is not to be taken in front of everyone. And we have to realize that temperature alone does not mean that somebody is going to test positive or not. Employers are allowed to take temperatures because we are in a direct threat, but I would not use temperature alone as a determination. I would definitely use the medical clearance before I would use temperature alone.
Okay. And would you recommend sending them home with a temperature or no at that point?
I would recommend they see their doctor immediately.
Okay. And Pat, when you were talking about the 3 feet in the meetings, a minimum of 3 or maximum of 3?
I think that's going to depend. It was a maximum of 3, but that's going to depend upon the area that you're meeting in. Again, the most important item there is to keep 6 feet, of social distance. Some meeting rooms are larger than others, and you can accommodate, maybe a few more. But I certainly wouldn't, congregate in groups, as large as 10 or so. I would try to keep that to a minimum. I believe the CDC guidelines are no group gathering 10 or above, but that has changed over time. So I'd refer you to the CDC site for the most, CDC site for the most recent number, but I believe it's 10.
Thank you. And if their worker in a certain department can't maintain a 6-foot distance, should they wear a mask? And if so, do they need to implement a respiratory protection program if it's just an N95 face filtering mask?
So yes, they would need to implement a respiratory program with an N95 mask. We do have templates for that as well, but the most important item to look at there is the fit test to make sure that they're actually using the N95 mask appropriately and effectively to prevent the disease and so forth. Now, OSHA has issued some guidance around this because there is a shortage of N95 masks out there, and the CDC and OSHA has recommended just you can use cloth masks if you don't have those N95s in place, because they believe that that is better than having nothing at all. So my answer is if you are going to do the N95 mask, you need to start working on training your employees according to that respiratory standard. And again, I can help get you a program with the training and so forth. It might be a little bit difficult to go out to a third party right now and do the fit testing, but there are guidelines around that as well. And as far as six feet of social distance, where you can't have that, I would highly recommend that you have some sort of mask on your employees or workers.
Very good information. And if an employee becomes ill at work because of a coworker, is that a workers' comp situation?
Now that depends. Because that depends, just like everything in workers' compensation. Yeah, that's a great question. First of all, would the hypothetical employee be in the medical industry? Because these are exposure cases, and exposure cases go to a higher level of evidence. The majority of workers' compensation claims are, preponderance of evidence. That's like almost anybody can file a claim. Exposure claims, you have to have clear and concise evidence. So that means that now the medical industry may be the easiest to hone in on. So a doctor tests positive and they just treated a coronavirus patient. That would be a direct causation. You can identify the source. That would be an easier one. But just because they went to work and discovered through the rumor mill that a coworker tested positive, and now they're afraid they're going to test positive, or if they do, that they can directly relate their work as a major contributing cause, the claim would probably be denied.
Okay. And we talked about an employee not wanting to come to work because they were scared. What if they have an underlying health condition?
Even employees or people with underlying health conditions can still come to work should they choose to. Now, if they do not choose to come to work, the recommendation would be that they seek medical attention. And I just had one the other day. The employee went to their primary care physician, provided a disability certificate stating they had an underlying condition. The doctor signed off. That was supporting documentation.
And if someone tests positive at the facility during the 14 days prior to the test, do they test everyone in the plant or just people they were in direct contact with?
And again, you're now your discovery period. You're asking, the employee who they became in direct contact. Is anyone in their family have it? You have to go through a system. Did somebody or friend just travel and came back from even though it's not country specific anymore, we have to ask those questions. So it's investigating.
And what about the other folks within the plant, the entire plant? When that employee comes back positive, should you be testing everyone in the facility or just the people, your employees that were in direct contact?
So,
you have a duty to notify all of your employees that someone has tested positive so that they can make arrangements too. And of course, the employer will have to do their duty to disinfect, clean. As Pat had mentioned, he has a great program. But yes, you do have to notify all your employees. The recommendation would be that they get tested.
Okay, great. And what posters is a facility required to post? Where should they post it? And do you also have any sanitation practice templates available?
I will take the poster question because that was a two-part almost. Yes, that was a two-part question. I'll take the easy one. Yes, employers are required to post the FFCRA, which of course is the Families First Coronavirus Response Act. They are required to post it by April 1st. So if they haven't posted it already, they should post it at their workplace. My recommendation would be, because a lot of employers have employees teleworking, that they post it on their website. That way, any and all employees will have access to it, but they should post, if they haven't, post today because unfortunately they're a little late. It should have been posted by April 1st. It is in English and also in Spanish. You're not required to post in Spanish, but it would be nice if you did. And again, the recommendation would be to put it on your website.
All right, and thank you, Ann. And for the second part of the question, which is the sanitation practice templates.
So I think that's a two-part answer. I think the first is I would highly recommend that you go to the CDC EPA website and identify what disinfectant that you're using and follow the instructions for how to use that particular product and identify what types of surfaces you're cleaning. I think the second part of your question, the second part of the answer around that and more directly related to your question around a sanitizing template, I think what you're asking is, do I have a template that kind of instructs you what to clean in the facility, how to clean it, how often to clean it, and the documentation. That currently I believe we've got a one-page document on it, but we do not have a fully vetted out program yet. But thanks for the idea. Look for it soon on our website.
Okay, great, thank you. And Ann, one final question. Is there anything else you'd like to mention as far as the new sick leave laws? Anything we haven't gone over as in regards to COVID-19?
Yes, and again, let me preface this by saying that FFCRA, there is federal and non-federal, and it is for employers 500 or less. Let me preface that by saying that first and foremost. And it is a two-part. there is the emergency paid sick time, which gives 80 hours. And then there's the extended FMLA. With the and because it's two parts, there are 6 qualifying reasons that you may get the emergency sick pay time, and there's different payments depending on the reason, and the poster will have all the reasons. But on the FMLA, I want to make it kind of clear, not just on the FMLA, but also on the sick time. If you are staying home because you have a child that their school is closed, or they're doing online schooling, which is online schooling is still considered closed schooling, it is only one parent that would be eligible for the emergency sick paid time off or the extended FMLA.
Okay, thank you. That's good to know.
Because it's not real clear in the writings, but it is for only one parent.
Okay, thank you. And Anne or Patrick, do you have anything additional you'd like to add before we close?
Stay safe and stay healthy. That's about it.
Yes, very important.
Yeah, very.
Well, as we mentioned earlier, the recording, links, and documents for the webinar will be emailed out to all attendees within a few days. We do have a few more webinars coming up. We're going to be focusing on employee development coming up in the future, how you can use this time positively to come out in a better situation once this is all over. So we do have a webinar on April 21st and another one on April 29th. So please keep a lookout for our upcoming webinars. If you have any suggestions on something you'd like to see, please let us know. I'd like to thank Hildy, Patrick, and Anne for providing us with this very valuable information today, taking their time. So thank you so much for joining us. And
Thank you.
Would like to mention, thank you so much, that as you exit the webinar, there is a survey. So at that time, please fill out the survey so we know how to improve the webinars and better meet your needs with topics of value to you in the future. Thank you again for attending. Have a wonderful weekend. Thank you. Stay safe and stay healthy.
Thank you.
Thank you. Thank you.